Endocrine medications. Thyroid. Generic and brand name. Levothyroxine sodium, brand name Levity. Generic methimazole, brand name Tapazole. Liothyronine sodium, T3, brand name Cytomel. Mechanism of action. Stimulates metabolism of all body tissues by accelerating rate of cellular oxidation. Inhibits synthesis of thyroid hormones. It supplies the thyroid hormones normally produced by the body. Major adverse effects: nausea and vomiting, signs of increased metabolism, tachycardia, hypertension, cardiac arrhythmias, anxiety, headache, tremors, palpitations. Health teaching with rationale. Monitor weight vital sign. Decreased weight is an indicator that the medication is effective. Instruct client to take daily medication the same time each morning without food. The absorption of the drug is decreased in the gut. Taking the drug before food is intake to avoid erratic absorption of the hormone. Monitor blood tests to check the activity of thyroid. To tell if thyroid gland is functioning properly by measuring number of thyroid hormones in blood. Advised to report palpitation, tachycardia, and chest pain. Medication may cause CV collapse in undiagnosed CV disease because the drug increases the basal metabolic rate, thereby increasing heart rate. Instruct to avoid food that inhibits thyroid secretion like cabbage, spinach, and radishes. These foods interfere thyroid absorption. Antithyroid. Generic and brand name. Methimazole, brand name Tapazole. Generic sodium iodide I-131, brand name Hycon. Generic potassium iodide, brand name Pima. Mechanism of action. It interferes with the step that causes the iodination of tyrosine reduced in thyroglobulin mediated by the enzyme thyroid peroxidase, thus preventing the synthesis of thyroxine T4 and triiodothyronine T3. Major adverse effects: drowsiness, lethargy, bradycardia, skin rash, GI complaints, arthalgia, myalgia. Most important to monitor for agranulocytosis. Side effects of iodine solutions logos: iodism, metallic taste, burning in the mouth, sore teeth and gums, diarrhea, and stomach upset. Health teaching with rationale. Monitor vital sign T3 and T4. Weight. The medication with meals. Take doses of this medicine regularly at the same time each day. Instruct to report sore throat or unexplained fever. Do not share cups, glasses, plates, or eating utensils. Wash it promptly after using. Monitor for signs of hypothyroidism. Instruct not to stop abrupt medication. Take potassium iodide exactly as directed. Do not take more or less of it than directed on the package label. Steroids. Generic and brand name. Cortisone, brand name Cortone. Generic Stanzolol, brand name Winstrol. Generic Estradiol, brand name Estrace. Mechanism of action. Suppresses the migration of polymononuclear leukocytes, type of white blood cell, and decreases the capillary permeability. Promotes cell growth by binding to an androgen receptors and stimulates erythropoietin production and protein synthesis. It is a female hormone and increases the blood levels of estrogen, and it acts by interacting with the target cell receptor, and once it is bound to a ligand, it induces formation of messenger RNA. Major adverse effect. If high doses, osteoporosis, growth retardation, peptic ulcer, hypertension, cataract, mood changes, hirsutism, and fragile skin, hypokalemia, edema, peptic ulceration, and increased susceptibility to infection or immunosuppression. Health teaching with rationale. Monitor vital sign, electrolytes, glucose. Electrolytes are essential for health and glucose is very important energy source. Monitor weight, edema, and IO to make sure the drug works. Protect patient from infection. This drug suppresses immune system. Instruct to take meds with meals. It is best taken with meals. It may cause complication on an empty stomach. Caution the patient not to abruptly stop the drug to avoid further complications in the body. Drug is tapered to give time for glands to back to their normal function. Evaluation. The drugs are effective if there is relief of signs and symptoms of inflammation, return of adrenal function to normal. If there are missing signs and symptoms in the treatment, especially if the adrenal function didn't go back to normal, then the drug was taken incorrectly and may cause serious complications. Anti-diabetic drugs. Example of ultra-acting is Lispro, and onset is 15 minutes and peak is 1 hour. Example of rapid acting is regular insulin, and onset is 1 hour and peak is 2 to 4 hours. Intermediate acting example is NPH and Lente, and onset is 1.5 to 2 hours and peak is 6 to 8 hours to 12 hours. Example of long acting is Ultralente, and the set is 4 to 8 hours and the peak is 10 to 20 hours. Common side effects for each insulin type. Ultra-acting, dizziness or lightheadedness, headache, shakiness. Rapid-acting, blurred vision, sweating, hunger. Intermediate-acting, trouble concentrating, confusion, seizure or convulsion. Long-acting, swelling of your arms and legs, weight gain, skin changes at the injection site. Health teaching with rationale. Insulin is administered at home subcutaneously because injecting at the fatty tissue would store the insulin for a long time. Cloudy insulin should be thoroughly mixed by gently inverting the vial or rolling between the hands to prevent cloudy insulin from entering the clear insulin bottle. Insulin not in use should be stored in the refrigerator, but avoid freezing or extreme temperature to prevent bacterial growth. Insulin in use should be kept at room temperature to reduce local irritation at the injection site. This works because all the standard insulin preparations have preservatives in them, which will keep the insulin good for a while but eventually stop working. Bacteria begin to grow in the insulin and start breaking down the protein. Insulin may be kept at room temperature up to 1 month. If being refrigerated, it may last up to 28 days. Selected syringes that match the insulin concentration U100 means 100 units per milliliter to prevent complications. Instruct the client to draw up the regular or clear insulin first before drawing the intermediate acting or cloudy insulin to prevent contamination, because once it is contaminated, it will affect the action of insulin. Pre-filled syringes can be prepared and should be kept in the refrigerator with the needle on the upright position to reach the measurement equal to the dose you plan to inject. The four main areas for insulin injection are abdomen, upper arms, thighs, and hips. Insulin is absorbed fastest in the abdomen and slowest in the hips. Abdomen has less muscle than the hips. Instruct the client to rotate the areas of injection but exhaust all available sites in one area first before moving into another area. By rotating the injection sites, it will make your injections easier and safer and more comfortable. If the same injection site is used over and over again, you may develop hardened areas under the skin. Alcohol may not be used to cleanse the skin. To remove the spread of bacteria before administering the insulin, utilize the subcutaneous injection technique, commonly a 45 to 90-degree angle, to administer the insulin properly. No need to instruct for aspirating the needle because it is not necessary. Properly discard the syringe after use to prevent injury and disease transmission. Oral hypoglycemic agents. Generic and brand name. Glipizide. Brand name Glucotrol and Glucotrol XL. Mechanism of action. This drug acts by partially blocking potassium channels among the beta cells of pancreatic islets of Langerhans. By the blocking potassium channels, cells are depolarized and result opening of voltage gated calcium channels, resulting calcium influx. This encourages insulin release from beta cells. Major adverse effects: nausea, vomiting, loss of appetite, diarrhea, constipation, upset stomach, headache, and weight gain may occur. Generic and brand name. Generic metmorphin. Brand name are Fortamet, Glucophage, Glucophage XR, Glometza, and Rayomet. Mechanism of action. This drug decreases hepatic glucose production. This also decreases the intestinal absorption of glucose, and this improves the insulin sensitivity by increasing peripheral glucose uptake and utilization. Major adverse effects: heartburn, stomach pain, nausea, gas, and constipation. Generic and brand name. Generic Rupaglinide, brand name Prandin and Gluconorm. Mechanism of actions. The activity of this drug depended on the presence of functioning B cells and glucose. This drug lowers the blood glucose by stimulating the release of insulin from beta islets cells of pancreas. Major adverse effects: low blood sugar, nausea, diarrhea, back pain, and headache. Health teaching with rationale. Observe for manifestation of hypoglycemia. Observing the manifestations, for hypoglycemia is significant for dosage adjustments, and client teaching for proper precautionary actions for hypoglycemic episodes. Assess for allergic reaction. Assessing for allergic reactions will prevent the prescription and administration of drugs that will most likely make an allergic reaction to the patient and will improve the patient's safety. Instruct to take medication at the same time each day. Taking medication at the same time each day manages the condition or treats the chronic problem. Caution to avoid taking other drug without consultation with physician. Taking other drugs without consultation with a physician may cause fatal drug interaction. These medications should never be given to pregnant women, so rule out pregnancy. This medication causes teratogenic effect. Instruct to wear sunscreen. These medications increases the sensitivity to the sun. Advise to bring simple sugar to be taken when hypoglycemic episodes occur. Bringing simple sugars are important when hypoglycemic episodes help boost the blood sugar level in the body.